Today our guest is James Daabous. He's a registered nurse at the IC unit at Windsor Regional Hospital. James, welcome to the show today.
Good morning, Robert. How are you?
Terrific. How are you and your family doing during this pandemic?
What a question to ask. Honestly, we're doing well considering everything that's happened. It's May 12th today, and I made a kind of decision. There's a lot of nurses in our unit that have been able to and haven't been able to, and physicians as well that moved out of their house actually when this all kind of really started getting scary at the beginning, a lot of uncertainty, a lot of unknowns. And I made a choice to kind of move out just to protect my 8-month-old son and my wife. So I'm currently kind of living on my own, kind of far away, but yeah, that's what we have to do. And I kind of see him through FaceTime or window visits. So that's definitely difficult, but it's something I kind of just look to the future instead of looking in the past for. And as of right now, I think it's the best situation for it, but we're doing okay.
Well, congratulations to you and your wife on the baby.
Thank you. Thank you.
This is Nurses Week, and I offer a heartfelt thanks to you and all nurses. How is morale amongst the nurses with all the outpouring of appreciation from the community?
And touching on that, I do want to say Happy Nurses Week to all my fellow colleagues and everybody in the hospital. But on top of that, too, it's everyone in the community that's working right now and working towards helping everyone out that's really deserves a lot of thanks as well. Everybody in the hospital, too. So how's the morale around the unit? Honestly, we're doing okay. I feel overall we have a lot of support and we're doing well in that way. The community's been amazing in their outpour. Walking out of the hospital, there's people at a distance waving and saying thank you. I mean, there's little rocks around the hospital with little messages on them. I want to say out of the last 2 months, I would say more shifts than not, we've been fed by communities, restaurants in the communities or different places like that. Way too many to mention, but definitely would like to say thanks to all of them. So morale's pretty good. We feel safe in our job as of right now. We have the appropriate PPE. So I think, and we're really supporting each other, right? So those people, it's like another family at work. So we go to work, we support each other, we all understand what we're in, and we're able to talk about it amongst each other. So.
And I think that's part of it. You've been trained for this. So this is something that is not, it's a little new, but not totally new for you. This is what you do.
Yeah, it's what we do to some extent for sure. Again, a pandemic, we weren't necessarily trained for that, but in the same point, we had a lot of training and a lot of new education in the last 2 months that we were able to implement our basics, and go forward with that. So I feel like we are prepared and we're doing a good job at it, I feel. And management's been pretty supportive in it as well, so I feel good with it.
How has your job changed since the appearance of COVID-19?
Well, one of the biggest changes, if you walked into our intensive care unit, you notice every room is a separate kind of makeshift room with barriers. So the engineering department has kind of come in and built all these negative pressure rooms. So how it's changed is our PPE has, tenfold increased, and what we're doing, we're treating every patient basically like they have coronavirus when they are first admitted, just because we don't know. So we treat them with all the appropriate PPE. We take our time to get into the rooms. We don't rush in there like we usually do, and kind of we just make sure we're protected, because ultimately we have to go and take care of other patients. We have to be around our colleagues. Some people have to be around their families. So we just are really protecting ourselves. So the job's really changed. We've been educated well on what to do to protect ourselves and to protect the patient, as well as new treatment modalities for these patients as well. So there's been a lot of changes, but I feel like we're being constantly kind of updated with what to do going forward.
Part of that is the families not being able to see the patients, and there's a lot of stress there. We talked to Dr. Favitt the other week, who was in intensive care, and the difficulty of his wife dropping him off and then not seeing him for 3 to 4 weeks. Is there anything you're doing to help to alleviate some of that stress?
And that's a great point. One of the biggest changes we've had in the hospital was actually visitors not being allowed. And truthfully, I know it may seem to some people in the community that that's a horrible thing to have, but ultimately we were really trying to protect them, as well as protect the patients, as well as protect the healthcare providers in the hospital. So what we've been able to do, fortunately, is we have iPads on the unit, and whether it's through Skype, Zoom, or FaceTime, we actually call the family. We have a code that they can call and get information on their loved ones, so it's confidential, that we're not giving it out to everyone. But they call, they give us a number, and we are able to get in touch with them through FaceTime. So even if our patient is intubated on a ventilator and not waking up, we're at least able to show them that, hey, this is your loved one, this is what's going on, constant updates with them. And if they are awake, we're able to get in there, and a lot of times the family talking to them, we can see positive results in our patients as well. So and we've at times even left the iPad in there for, an hour at a time and just let them kind of have their private visit with one another. And it's worked out, I think, the best that we can do right now, and it's working well.
Well, it's good to have that contact. Are you involved? We've seen numerous reports on the news. We saw it here with Dr. Favit. Once they've completed and they've tested negative and they can go home, the whole walk down the hall, or I guess wheelchair down the hall with all the nurses applauding them as they leave, and the emotional. I know he told me it was very emotional for him. Are you involved with any of that? Are you able to see as your patients leave?
In the intensive care unit, our patients don't usually leave home from there. We usually transfer them out to another type of unit, and from there they go home. So we don't get to see that part of it, but I do get to watch it online and whatnot. But we've had a lot of success stories. It's been kind of mixed, but when you hear that these patients are doing really well, when they initially come in, they're extremely sick, and we are very worried about their length of stay, what's going to happen to them. Are they going to continue testing positive? Like, what are we going to do from here on out? And the patients that do end up doing well and going home, it's, we kind of just give each other a pat on the back and say, wow, we did it. And it's really awesome to hear. I'm talking to the families and hearing them going, holy smokes, I can't believe they're, where they're at right now. It's rewarding, right? And that's why we do it.
What can you advise the community about the serious nature of COVID-19?
So as a nurse talking to the community, it's definitely a serious thing. And I'm not just saying that because I'm prompted to say that, or I feel that I need to say it. It's my due diligence. It's truthfully a very serious illness. And though it's not affecting younger adults as much, though it's not affecting children as much, we can still carry it on to our grandparents and our parents that may be elderly. We've had incidences where patients coming in and they really have no prior health history, and they've contracted and they're okay, but they live with mom at home, and mom's been quarantining herself, but I go out and do groceries, I come home, whatever it may be, excuse me, and I've given it to mom. I see a lot of people in the grocery store. Gloves are great if you know how to use them properly, but I see people, they put on their gloves, they go in the grocery store, they feel fearless. I can touch everything, I can do everything, I have gloves on. But then they grab their phone in their back pocket, they send off a text message, they ruffle through their purse looking for something, and then continue to wear those gloves. And then, so everything you've now touched in the grocery store has touched your phone, has touched your purse, has touched your wallet, whatever it may be. So that sense of fear that everybody wearing gloves, it doesn't really help. So you just really need to protect yourself. Soap and water kills it. That's the number one thing to do. If you have hand sanitizer, obviously that works well, but it is definitely serious. We are seeing patients die from it. And we're seeing patients do well too, but it really just, it can drive from 0 to 100 really, really, really fast. We see patients starting on nasal prongs of oxygen, just having some shortness of breath, to all of a sudden being intubated within a couple hours, that they were never expecting to kind of go there.
Well, that's good advice for our community, because there's been a lot of discussion throughout the media and social media about, do I need to wear a mask? Do I not need to wear a mask? Are gloves, the total protection? And so I think that's important to get that word out, to let people know.
Sure. And these cloth masks that people are wearing, they're great in a way that I'm not going to be protected from someone else droplets coming to me, but I'm going to potentially protect my own droplets from going to someone else. And that's what we have to think too. So when I go to the grocery store, if I go, I'm putting a mask on because I have been in contact with these patients, right, in proper PPE and everything, but I want to make sure that my droplets aren't passing on to anyone else.
Excellent. Okay, looking forward to some hope. What are you looking forward to after the pandemic is over?
Absolute number one thing is I want to hold my son. My wife's sending me daily updates, and he started sitting a couple of days ago, and all of a sudden now he's pulling himself standing up, and I think he's gonna drive us a little bit nuts, but that's okay. So I'm looking forward to kind of getting on the ground with him, crawling around and playing, and then obviously seeing my wife, my mom, my dad, my entire family. So I just, human contact's a nice thing. It's good when we're close to our coworkers at work, but that's about all we kind of get, right, when we're living away. So hoping to obviously get back to them soon. And this could last for a long period of time, so we just need to be smart about it and see how we're going forward with it.
Yeah, I think it's better to err on the side of caution than
100%.
Yeah. Well, James, listen, I really appreciate your time this morning. Thank you for all you do. Thanks to all the nurses. Please pass on the appreciation to everyone. at Windsor Regional Hospital. And please stay well and stay safe.
Definitely. It's a huge thank you to like all of my colleagues, everybody that works in the hospital, the grocery stores, McDonald's, Starbucks, everyone's doing their part out there. So just continue to wash your hands and protect yourself and protect everyone else.
Thanks, James. That was James Daabous, RN at ICU at Windsor Regional Hospital.